Okay, good afternoon, everyone, and thank you again for joining the daily briefing on the City of Philadelphia's response to COVID-19. And today our speakers are joining the briefing virtually to adhere to social distancing guidelines. We'll begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everyone. Memorial Day weekend is now just a few days away, and obviously it will be unlike any previous Memorial Day. With some beautiful weather in the forecast, it will undoubtedly be tempting to cast aside the very necessary restrictions that are imposed because of the pandemic. I urge everyone to resist the temptation of taking part in large gatherings. There may be a tradition for you and your family, but it's still simply too risky, and we want to see you around next Memorial Day to celebrate. We have made a lot of progress thanks to the willingness of just about everyone to step up. Case counts are lower and testing is now more readily available. The last thing we want to see at this point is a holiday weekend wiping out all that progress. So stay 6 feet apart, avoid large gatherings, please wear face coverings, and make sure that you and your loved ones stay safe. The Monday holiday will impact some city services. Trash and recycling will not be collected on Monday. Residents who have collection on Monday should set their trash and recycling out on Monday evening after 5 o'clock for collection on Tuesday. Trash and recycling collections will be 1 day behind for the remainder of the week. All Philadelphia parks and recreation, parks and trails will remain open on the holiday. However, barbecues, large picnics, and other group gatherings are not permitted. Residents are encouraged to enjoy parks safely this weekend and visit on your own with members of your household. Also, please, if you think about it, bring a trash bag with you. I know that the trash cans over the weekends get quickly filled and overflowing. If there's some way you could put your own trash in a trash bag and bring it back to your household can, that would really be a big help in keeping the trash problems down in our parks. Also, many of the sites offering free food and meals will have different schedules next week due to the holiday. Residents can call 311 for help finding a food pantry or text their zip code to 1-800-548-6479 to receive a list of nearby food pantries. That's 1-800-548-6479. Monday meal distributions at the Parks and Rec youth meal sites, Tarkin and Scanlon playgrounds are rescheduled to Tuesday, May 26th. The 40 city-supported food box distribution sites will be closed on Memorial Day. Food sites will open instead on Tuesday, May 26th from 10 a.m. to noon. And the temporary outdoor meal sites at City Hall and Key School will also be closed on Memorial Day. Philly's 311 call center will be closed on Monday. Residents can still submit requests online at phila.gov/311, or you can submit a request through the 311 application. All city district health centers, as well as the city-run COVID-19 testing site in Center City, will be closed on Memorial Day. We will also not be holding this daily briefing on Memorial Day, Monday, but the communications office will issue a press release around 1 p.m. There are many more details about the Monday holiday and the press release that our office is issuing shortly and which will be posted on phila.gov. Now I'd like to turn it over to Dr. Farley for his daily update.
Thank you very much, Mayor. We're continuing to make progress against the coronavirus epidemic in Philadelphia, but I do have some sad news today. So here are the details. As far as cases, we have 227 new cases of the infection confirmed in Philadelphia residents since this time yesterday, bringing us to a total of 20,359 since the beginning of the epidemic. And that daily number is still falling overall, so we're clearly making progress as far as the number of cases every day. We're continuing to make progress in our congregate settings. If you look at the graph on our website about our nursing home cases, you can see that those are on the decline. And we've had 0 cases in the jail since this time yesterday. I just want to remind people that we will be starting screening of all the inmates in the city's jail. And so with that, we do expect that we're going to find some additional cases in the future. We'll see how many, and then we'll report those out when they come out to us. In the city's hospitals, we had, as of yesterday afternoon, 635 inpatients with the infection in Philadelphia hospitals, and 1,212 in hospitals in the Southeast Pennsylvania region. Those numbers are about the same as they were yesterday. So with deaths, this is where I have the sad news. Now I can confirm 103 new deaths, 103 since this time yesterday, bringing us to a total of 1,152. So here's the explanation. This is similar to what happened last week. Each day, we get information about people who may have died in the previous day or two from coronavirus infection, and we're tested at the time. We count those. But then about once a week, we take the database we have of previously reported cases, and we match it up against the database of death certificates to identify people who were reported first as a case while alive and subsequently died. Those death certificates are somewhat delayed, and so it takes a while for that information to come in, and we do that on a roughly weekly basis. And so when we do that match, we pick up many cases that occurred in the past. That's why we have this very large number today, 103 new deaths. If you look at the graph of deaths we have per day, it definitely has a rise and a peak and a fall, and so we're clearly declining. So there's still sign of progress against the epidemic. But it does say that the peak of the epidemic is worse than we had estimated before, and the total number of deaths from the epidemic is higher than we estimated before. Of those 1,152, there were 622, or 54%, in nursing home residents. Now, a little bit on testing. We are now really encouraging anyone at any age who has respiratory symptoms, new respiratory symptoms, to come in and get a test. Anybody with a new onset of a cough or shortness of breath or a sore throat or fever, come in and get a test. There are 47 sites that you can learn about on our website, www.phila.gov/testing. There's a really nice map there. And starting today, we're going to be highlighting those clinics in each neighborhood to the people living in that neighborhood so they know about the availability of sites in their specific neighborhood. We're going to be putting out messages on social media. We're going to be putting messages on neighborhood next door accounts. And we're going to start automated phone calls to people in the neighborhood, letting them know exactly where the nearest free testing site is and how they can access that. In particular, what the phone numbers are for those clinics, because all those clinics really want people to call ahead and make an appointment. For everyone who's not having symptoms that doesn't need testing, just a word, we are getting closer to reopening. We clearly don't have a date yet when we can move to the yellow phase. And everybody wants to know what that date is. Even I want to know what that date is, but we can't give you a date now. And I want to focus less on when we reopen and really start thinking of how we reopen. So whenever we do reopen, we know if we don't reopen in a safe way, the epidemic will return, and then we'll have to have another shutdown, and nobody wants to have that happen. So to do that, wearing a mask is going to have to become normal, expected behavior. This is what we do when we're around other people. In the future, it's going to have to be so that going into a store without wearing a mask is like it is now to go into a store without wearing a shirt. It's just something that people don't do. So if you haven't done it yet, get a mask and get used to wearing it. More information about the epidemic and all of our data is at www.phila.gov. Thanks.
Thank you, Dr. Farley. Now, Armando will provide the Spanish language translation of the mayor's and Dr. Farley's comments.
Mensaje del alcalde Jim Kenney para el día miércoles 20 de mayo del 2020. Buenas tardes a todos. El fin de semana de Memorial Day o Día de Remembranza serán solo unos días y este año, obviamente, será una celebración muy diferente a las de otros años. Con un pronóstico del tiempo fabuloso, sin duda será tentador dejar de lado las restricciones que debemos observar debido a esta pandemia. Les pido a todos, por favor, que resistan la tentación de asistir a reuniones en grupo. Puede que sea una tradición para usted y su familia, pero aún así es demasiado arriesgado. Hemos avanzado mucho gracias a la disposición de casi todos de cumplir con las buenas prácticas de distanciamiento social. El recuento de los casos cada vez es más bajo y las pruebas ahora están más disponibles. Lo último que queremos ver en este momento es que un fin de semana festivo borre todo este progreso. Por lo tanto, manténgase a 6 pies de distancia y, por favor, evite reuniones grandes. Use mascarillas al salir de su hogar y asegúrese de que usted y sus seres queridos estén a salvo. En otros temas, el feriado del lunes afectará algunos servicios que proporciona la ciudad. La basura y el reciclaje no se recogerán el día lunes. Los residentes cuya basura se recoge los lunes deben depositarla junto con sus artículos de reciclaje el lunes por la noche después de las 5 de la tarde para que se recoja el día martes. La recolección de basura y reciclaje tendrá un día de retraso durante el resto de la próxima semana. Todos los parques y senderos de parques y recreación de Filadelfia permanecerán abiertos durante este fin de semana festivo. Sin embargo, no se permitirá barbacoas, picnics y otras reuniones grupales. Desalentamos a los residentes a disfrutar de los parques de manera segura este fin de semana. Asimismo, muchos de los centros que ofrecen comidas gratuitas tendrán diferentes horarios la próxima semana debido al feriado del Memorial Day o Día de Remembranza. Nuestros residentes pueden llamar al 311 para obtener información sobre cómo encontrar una despensa de alimentos o enviar un mensaje de texto con su código postal al 1-800-548-6479 para recibir una lista de las despensas de alimentos más cercanas a su domicilio. La distribución de comidas de lunes en los centros de comidas para jóvenes de parques y recreación en el parque Tarkin y Scanlon se reprograma para el día martes 26 de mayo. Y los sitios de comidas al aire libre ubicados en el ayuntamiento y la escuela Key también estarán cerrados durante este día de remembranza. El centro de contacto de Philly 311 estará cerrado el lunes 25 de mayo. Los residentes pueden enviar sus solicitudes en línea por la página web fila.gov/311 o pueden enviar su solicitud a través del aplicativo 311. El sitio de pruebas COVID-19, administrado por la ciudad en el centro de Filadelfia, y todos los centros de salud de la ciudad también estarán cerrados este lunes 25 de mayo. Hay más detalles sobre el feriado del lunes que mi oficina emitirá en breve en un comunicado de prensa que se publicará en fila.gov. Y esta es la actualización en materia de salud para el día miércoles 20 de mayo del 2020. Desde ayer se han confirmado 227 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 20.359 casos en la ciudad. Siguen las buenas noticias y estamos viendo una clara mejoría. También hay progreso en la evolución de los casos en los entornos grupales. No tenemos nuevos casos del COVID-19 en las cárceles y actualmente tenemos solamente 3 casos confirmados. Sin embargo, esperamos encontrar más casos en las cárceles con la implementación de las pruebas de forma masiva. Hoy, tristemente, reportamos 103 muertes por la COVID-19 en la ciudad. Hay un total de 1.152 personas que han muerto por la COVID-19. Hemos identificado muertes pasadas a través de cruce de datos con certificados de defunción y esta es la razón por la cual damos un número tan alto de defunciones el día de hoy. 622 o el 54% de estas muertes han sido en hogares de ancianos. Recordamos que este virus no discrimina por raza o por género. Informamos que hasta ayer por la tarde, 635 personas han sido hospitalizadas en Filadelfia y 1.212 personas en la región sureste de Pensilvania. Estas cifras nos demuestran un claro descenso en las admisiones a los hospitales y hay que recordar que las pruebas ahora están disponibles en 47 centros ubicados a lo largo y ancho de la ciudad de Filadelfia. Usted puede ubicar el centro más cercano a su domicilio visitando fila.gov/testing. En el pasado teníamos acceso limitado a las pruebas debido a que había poca disponibilidad, pero ahora les alentamos a todas las personas de cualquier edad que tengan fiebre o síntomas respiratorios a realizarse la prueba del COVID-19. Las pruebas están disponibles con cita previa. El éxito en la contención del virus demuestra que la mayoría de los residentes de Filadelfia son responsables. Nosotros podemos cambiar cómo nos comportamos diariamente. A medida que nos acercamos a la fase amarilla, vamos a tener que cambiar nuevamente nuestras costumbres. Vamos a poder salir de nuevo, pero tendremos que usar una máscara para salir. No es difícil, de hecho, y puede ser más fácil que quedarse en casa. Consiga una mascarilla o cubierta facial y acostúmbrese a usarla. Mi máscara te protege a ti, tu máscara me protege a mí. Juntos podemos superar este gran reto. Gracias.
Thank you, Armando. We're now going to move to the Q&A portion for members of the media. Remember, we have limited time during the briefing, so only one representative from each outlet is permitted to ask questions during the first round. Reporters are asked to limit their questions for each round to 3 or fewer, and we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature found under the participants list. And we ask that you use your video to ask your questions if you're able when you're called on. We will unmute the reporters one by one to ask questions. And starting off today with Jeff Cole of Fox 29.
Hi there. I have a questions today for Dr. Farley. Dr. Farley, the Pennsylvania Department of Health last night released total numbers of COVID-19 cases in the state's nursing homes and number of employees contracted the disease and deaths in the nursing homes. They seem high, certainly in nursing homes across the Commonwealth. In Pennsylvania, in Philadelphia, there seem to be some homes where the number of deaths come close to half of the number of total cases they had. You've long said here that nursing homes have been hard hit. But what do you make of these numbers now that you've seen and the public has seen the full tabulation?
Well, they show at the nursing home level that, in fact, the nursing homes were hard hit. And we've been talking about that since the beginning of the epidemic. These are institutions where it's hard to control the infection and very frail people, very high risk. It's been tough on nursing homes across the city, across the state, across the entire country. And so this is, people can see it at the nursing home level now, but this is exactly what we've been seeing since the beginning.
Dr. Farley, does it say something, though, about how nursing homes are run in the country, the number of people that are often in these facilities and the often low-wage workers who work there? Does this speak to a need for reform in the nursing home industry?
I do think that we need to think about how we restructure or change the way we operate those institutions in order to be more protective in the future. They don't have the kind of resources that a hospital does to prevent infection spreading from one resident to another. And so reform may not be too strong a term to talk about how we really, what kind of changes we need to make in order to solve this problem. I will say here, we feel like there's been more progress made when hospitals have been involved working with nursing homes to provide the kind of expertise and additional resources that a hospital has to help them with infection control in that facility. And so we're looking at, right now we're encouraging hospitals to step in and work with nursing homes in a supportive way. And there may be some role to make that, formalize that, to have hospitals and nursing homes have affiliation agreements where they can provide support on an ongoing basis in the future. I don't know, I don't have a concrete recommendation yet, but I do think that they need more resources in order to be able to protect themselves against this.
And final question, do you think the Pennsylvania Department of Health, do you see any deficiencies there with how the Pennsylvania Department of Health early on handled this? I think I know at some point the Department of Health was mandating that nursing homes take patients from hospitals with COVID-19, and that may have advanced the spread. Can you speak to that in some way, unless I'm wrong on that?
I don't know about such a mandate. I don't think so. I don't have no criticism for where the health department has dealt with this. This is more an issue of nursing homes, their basic structure there. They don't have a lot of resources. They don't have a lot of staff. They don't have a lot of experience with the kind of intensive infection control procedures you need. And so they just were not able to handle this. And that's a national phenomenon.
Thank you.
Thank you, Jeff. Now we're going to go to Mitch Blocker of NBC.
Thank you. I have a couple of questions for Brian. The mayor talked a little bit about trash, and I'm curious, with more people at home and there's more trash now being collected, how is that actually affecting service in the city?
So, we've talked a bit about sanitation's staffing challenges. Those staffing challenges certainly continue, and the department's trying to make adjustments as we go. And so they are, specifically on days where, or on weeks when there are collecting recycling as well. They're running at least a day and sometimes 2 days behind. But I think all in all, sanitation's done a nice job, and those workers should be commended for continuing to service the residents given the challenging times we're in.
Can I add something? Can we add something about the trash? Because people send me videos all the time of trash day and what it looks like. I mean, you have to take some care in putting out your trash at the curb. I mean, I see people throw their trash to the curb from the front top step. The trash is not tied up. The bag breaks open. The trash gets scattered. The recycling materials are not broken down and secured on a windy day. I've talked earlier about trash overflowing in our larger parks. Bring a trash bag with you. Take that trash home. Don't throw your trash out your car window. I mean, there's certain things that every citizen can do to help our city stay cleaner. I'm a little bit anal when it comes to putting out trash, but I make sure that our recycling secured and tied in the box securely or in the recycle container, that there's lids on trash cans so that the trash cans aren't overflowing, and that you put your trash out neatly and give the workers an opportunity to collect it in a more neat way, so that their jobs are easier and they can move faster. So just some human advice for trying to have a cleaner city.
Thank you. Is there a plan for how some of the stuff that is out there from the wind, from people not having the care that you're talking about, Mr. Mayor, how will it be cleaned up?
I mean, when we get back to somewhat normal with normal schedules, and we're with our new budget does not have street cleaning, sweeping citywide like we do. We're going to continue to maintain the pilot programs. But again, if you're in Roosevelt Park, for example, where I spend some time on a bike, and you see overflow trash cans, just don't throw your trash on top of the overflow trash can, because it's probably going to blow away. It's just more common sense, and I would treat our parks and facilities as you would treat your own home.
And one last question. The city's waste contractor has said it may need to increase rates for trash disposal. This is waste management. I'm curious how the city would be able to absorb that cost.
I think that would be it would be challenging for us to absorb the cost. It was not, at least from my understanding, not included in the budget submission. We're continuing to evaluate and review sanitation collections, and we'll make adjustments as necessary. But hopefully those increases won't come to fruition. And if they do, we'll find a path forward, as we have throughout the crisis. Lots of unexpected things have come our way the last few weeks.
Thank you all.
All right. Thank you, Mitch. Next, we go to Natasha Brown of CBS 3.
Hi, just have a question just for Dr. Farley. I'm just wondering, is the state and the city, obviously, once we move into the reopening phase, are you going to be following CDC guidelines for reopening? And if you can provide an example of what that would be like, and if that's not the case, then why would we not be?
So CDC puts out, I understand what you're asking about, has put out recommendations for how to operate in a certain business or certain activities in ways that's going to reduce the spread of infection. Those are recommendations, and they're recommendations that we put a lot of stock in. We have a high degree of respect for the CDC's expertise, but we are working on our own guidelines for how a variety of activities can operate safely, and those will rely on the CDC's guidelines. They may extend them for places where CDC hasn't put out anything else. We may adapt them, but so we'll pay attention to them. But we're also going to try to give people some very clear advice locally.
Okay, great. That's all I have. Thank you.
Thank you, Natasha. Next up is Max Marin of Billy Penn.
Hi, everybody. Thank you. Question for the mayor. Have you given any further thought to making it easier for restaurants to have outdoor seating? I know several cities now have introduced plans to dedicate parking spaces in other areas of the street for this, and there's currently a bill in the PA House that would allow temporary seating in parking lots in other areas. What are your thoughts?
Look, first of all, this is a governor decision on whether or not we reopen, to what degree we reopen, and how fully going forward we reopen. Dr. Farley, Chief of Staff Jim Engler have been working with the surrounding counties in the region to try to have a kind of comprehensive approach that we all can move forward on. I certainly believe that we should do everything we can to help restaurants when the time comes, but I'm not going to recommend or support something that puts people in danger because they're in too close proximity to each other. A lot of this will be determined at the time the decision is made, what our numbers look like, what the data shows, how many new cases and new deaths, and that'll all factor into what we're able to do, when we're able to do it, and to what extent. I recognize the restaurant industry suffering terribly. All the workers are suffering terribly, but there's nothing worse than suffering than is death. And we'll do our best to accommodate everyone safely when the time comes.
And Max, just to add on to that, we certainly have kept an eye on what other cities are doing as far as it comes to parking lanes and to travel lanes and expanding access to sidewalks for restaurants, et cetera. The Office of Transportation, Infrastructure, and Sustainability are reviewing those efforts and are working on what, if anything, Philadelphia could support going forward. So it's something that we're working on, but nowhere close to being able to make an announcement.
Okay, thank you. And Mr. Mayor, I want to just circle back on the trash issue. I mean, considering the delays in pickup and considering the image you mentioned of the overflowing trash can in the park, I mean, has the city considered at all maybe expanding the number of public trash cans at this time? I mean,
I've brought the issue up with a couple departments. I don't know if it's practical or not. but I will tell you, even, and I'm sorry that the trash is delayed. We have a lot of issues relative to staffing and other things, and our sanitation workers are working as hard as they possibly can. But even if the trash is delayed a day or two, and it is wrapped up and secured in a good way, it won't blow around the neighborhood. If the bags won't open, if they're tied properly, if they're in trash cans with the lid shut, they could sit out there for an extra day or so and have no detrimental impact on the condition of the city. I rode through Roosevelt Park Saturday and Sunday. That's the park closest to me. I see people putting styrofoam containers on top of styrofoam containers in a trash can that's overflowing already. Perhaps you could, I would get a trash bag, take it home, and put it out with my regular trash. So it's just being thoughtful, and it's being, real about the situation that we're dealing with, and doing the best to be mature and direct about our problems and issues and how we can all solve them together.
But do you think we need more trash cans is the question if they're overflowing like that?
Well, no, the trash cans at the parks were not overflowing with household trash. The problem with trash cans in commercial areas and on larger streets is that people insist on taking their household trash out every day from their apartment or from their house and putting it in a public trash can. That creates it reduces the capacity of the trash can for someone walking down the street with a bag of chips that wants to throw it in there. There's no reason why you can't keep your trash in your house till trash day. And even though if it's delayed, if it's secured while it's in your driveway or at your curb, it'll stay secured until until the sanitation workers get it.
Okay, thank you.
Right.
Mike, if I may.
Thank you, Max.
Okay.
All right. We'll come to you in a second round. Jaime Becerril of Telemundo, you are up next.
Yes, this question goes for Armando. If you can please translate in Spanish the mayor's answer about trash problems and solutions.
Armando, you need to unmute yourself, please, Armando.
Thank you. Por supuesto, Jaime. Adelante, Jaime.
Sí, Armando, el alcalde menciona que se está manejando de una forma positiva en cuanto al ayuntamiento, pero que los residentes también deben de hacer su parte. Si nos puedes decir, por favor, esa traducción que el alcalde da a la solución del problema de la basura en nuestras calles y en lugares públicos como Kelly Drive, por ejemplo.
Well, this question is for the mayor. Mayor has been talking about trash problems and solutions and has been saying that City Hall has done a good job managing this issue. We'd like to know what citizens can do on their part to keep the trash issue at hand, especially in areas such as Kelly Drive, excuse me.
Well, first of all, I would refrain from throwing your trash out your car window. That would be a big help. I would argue that people can tie up their bags better than some people tie up their bags. The use of trash cans with lids is also always a help. And when it comes to recycling, tearing down the boxes and stacking them in a neat way in your recycling container, so that the boxes and cardboard don't stay out there in the rain or blow around in high wind in this time of year. And just using common sense. I mean, look, I grew up in a 2.5 bedroom row house in the middle of a small street with a very small yard, and you accommodated 6 people living in the house. So we generated a pretty decent amount of trash, and it went out on trash day. And my mother, taught us how to tie up the bags, put them out properly, and minimize the opportunity for that trash to be scattered around the neighborhood.
Por supuesto, lo primero que se puede hacer es evitar que la gente empiece a tirar su basura por la ventanilla del auto. Tienen que atar mejor las bolsas que lleva la basura, poner las tapas a los tachos de basura y traer su reciclaje de manera que lo puedan depositar en forma escalonada en sus contenedores. Por supuesto, tienen que tener cuidado de que las cajas de cartón no se las lleve el viento ni las moje la lluvia. Utilizar un poco de sentido común. Cuando yo crecí en una casa pequeña de 2 dormitorios y medio, en una casa que tenía un jardín muy pequeño y vivíamos 6 personas, por lo tanto generábamos una cantidad grande de basura, pero mi mamá nos enseñó a que teníamos que prepararla y tener la lista el día de la basura y con sentido común esto se puede lograr.
Gracias.
Thank you.
De nada.
Great. Thank you, Jaime. Next, Claudia Lauer of the Associated Press.
Hey, how are you today? This is for Dr. Farley. I just wanted to make sure that I didn't miscontextualize the increase in deaths. So I guess I'm trying to understand how 103, and I'm sure not all of them are from death certificates, but around 100 deaths aren't reported. What is the normal reporting process if somebody dies of COVID?
So there are multiple ways in which that information may come into us. It may be that somebody dies in a hospital, they have a positive test there, and so we get the report from the hospital. We may hear about it from a medical examiner or from a coroner in a neighboring county, or we may only learn about it later on when a death certificate appears in the death certificate database. We do this match against our case reporting database, and we pick up someone who was reported us as a case, and now we learn 2 weeks later that they died.
So are those people who die at home?
Some of those die at home, but many of them would. Most people don't die at home. But we may get the report from a laboratory of a positive test. We may not hear about it from the hospital, but then the next thing we know about it, we just get a death certificate that person may have died in the hospital or nursing home.
Okay, so they're spread out to multiple different settings, some congregate settings, some hospital. Okay,
correct.
Thank you.
And all I could say definitive is we got that information by, not for all of them, but for the large majority of them, from matching our case reporting database, which just has the fact that there's a positive test, with our death certificate database. And the death certificate database is somewhat delayed, which is why it's somewhat delayed in getting those numbers.
Got it. Thank you.
All right, thank you, Claudia. Now we go to Laura McChrystal of the Inquirer.
Hi, I have some questions today about the city's efforts to obtain PPE and other supplies. I understand that, of the many orders placed for those types of things, a lot of them the city has not yet received, a significant portion. I'm wondering if you could comment on, are those things that you still hope to get down the line, or are they sort of indefinitely back ordered or canceled at this point?
So I'd say that the two biggest PPE needs at this point are N95 masks and isolation gowns. And so we are looking at alternative isolation gowns, so the things that wouldn't normally be considered isolation gowns, so kind of improved ponchos, for lack of a better term, as well as some other items. Isolation gowns are going to just continue to be difficult to get. N95s, I think it's been pretty well documented at this point that the supply chain for N95s is hard to break through. We're not able to ship directly from China. My understanding is that China is only selling to governments at this point, not local governments. So that's going to continue to be an issue, and I think we are thankful for the support we've gotten from FEMA and PEMA in the state. Certainly know that they've made a number of direct shipments to our hospitals, and although I don't have complete visibility into those shipments, I know those shipments are continuing. I think the good news is that we've had pretty good success on getting surgical masks, and feel pretty comfortable with where we are on that front, and continuing to source fabric masks for both for our employees as well. So it's not all dire straits, and I think the hospitals have been creative in how they've had to ration their PPE, and in order to make sure that their employees are as protected as they can be. But it's certainly none of this is ideal for by any means.
Okay. And when you reference particularly N95s and isolation gowns, are you trying to obtain those for city use, or is it to give to hospitals at this point?
No, it's really to give to hospitals. I mean, we do have a need for some N95 masks, but the majority of that is really for how do we supply our hospitals and ease their issues.
Okay, and I've seen, as far as for the city's own use, I've seen that a lot of city departments have tried to place orders for hand sanitizer, masks, gloves, and it seems that those haven't come in? Have there been situations in which, city workers have been without them, without those items, or departments haven't been able to get what they need?
So departments are being asked to source all of that through the Office of Emergency Management. We do have plenty of hand sanitizers. We do have gloves, and we do have fabric masks, and are sourcing those for all of our departments. I'm not aware of any specific situations where I have workers that are going out without PPE. And if there are those situations, I think those are issues that we can address with our current stock.
Okay, thank you.
Thank you, Laura. Next up is Martin Pratt of Philly YBN.
Yes, this question is for Dr. Farley. Dr. Farley, have you seen the Korea CDC study that showed small gyms and what happens with COVID in an enclosed environment while working out?
I have not seen that study.
Okay. Could you, for my readers, explain a little bit about the density in a small gym or working out and the droplets, how that affects and why it's not good to be in that situation?
Well, let me just say that the way that this virus is transmitted is when people cough or sneeze, or to a lesser extent just talk, that they put out little droplets in the air, which for the most part you can't see. Those droplets don't last too long. They tend to drop to the ground, but if they're around long enough where if somebody is within a few feet, that somebody else may breathe those in or get them on their hands and then touch themselves, and the virus comes along for the ride. So that's why staying 6 feet apart helps protect people. That's why masks protect people, so that when you talk or breathe, you're not putting out those droplets. What I haven't seen is what the effect is of working on a treadmill does in terms of your droplet production. I would be concerned about it. I'd like to know more about it. I think, gyms is one of the locations we're going to have to think about what kind of safety procedures we put in place to make sure that we don't have transmission in gyms. Well, we're not there yet.
Well, you said earlier, this is my second question. You said earlier in preparing for a reopening, one of the things we have to do is wear a mask. And for small business owners in preparation for opening, should they be talking now to air ventilator folks or HVC folks and talking to their landlords about how air is going to be dealt with within a small business?
No, I think that they should be thinking about how they make sure that their employees are wearing masks, that their employees are screened before they come in to make sure that they are not working with symptoms. They should be thinking about, as far as physical changes, barriers, such as around a cash register, as you see like around grocery stores now. Think about floor decals to indicate where people should stand so they're 6 feet apart. Those sorts of changes that implement the basic ideas we've been talking about 6 feet apart and masks.
Thank you. And my last question is for the mayor. You talked about the trash being tied and secured. One thing that I've noticed is that we have a very, how do I say, aggressive squirrels, Mayor. And so I think part of this situation is
COVID squirrels, yes.
Yes. And part of this situation, would you recommend homeowners to make sure that there are lids on top of the trash?
Where possible. Look, I live in Old City, and what I notice on trash day is that apartment dwellers in Old City who don't have internal trash, basically throw their trash out in a bag, whether it's tied up or not, is random. In a windy day,
right. Somebody
goes through, even if an unsheltered person goes through the trash looking for whatever, it doesn't stay closed. And it could, I haven't seen much squirrel activity, but I'm sure that in certain neighborhoods where squirrels abound, that may be a problem. I know we've had problems with raccoons over the years, and we've had to deal with those kinds of things. But I just think if you use common sense and caution, make sure the bags are secure, make sure they're not overflowing, put your recycling firmly in the recycling buckets, especially cardboard. And even if the trash day is delayed or it's not picked up on the day it's supposed to, it'll stay secure. I mean, there's going to be certain elements. If you put food out in plastic bags that are not in a trash can, you have problems with vectors that will come and try to eat that food. I mean, so just think about how you're dealing with your trash, what's in it, and understand that we're we're in a bind right now, and we all need to work together to make it better.
So yeah, Mike,
Right.
I can get your quote is intentional. Be intentional
Martin.
about trash.
Yes, that's perfect. Thank you.
Thank you.
Great. Thank you, Martin. Kennedy Rose from the Philadelphia Business Journal. You're up next.
Hi, thanks everybody for taking the time. I have a question for Dr. Farley. I was wondering, what are the barriers to allowing restaurants to operate with outdoor seating, even if patrons are appropriately socially distancing?
We have not really thoroughly looked into this question of outdoor seating for restaurants. So I can't answer that question now. We'll look into that and see when it's appropriate. We're not really talking about opening anytime soon, so we have time to figure that out.
Okay, thank you. That's all I had.
Okay, thank you, Kennedy. We will now move to a second round of questions. And first up is Max Marin of Billy Penn.
Hey, this is for Brian. Just to follow up on Laura's questions about PPE from earlier. And some of the inventory records show that orders for isolation gowns in particular are behind as far as 2 months right now. What is the city's process for procuring these masks? And if it goes on long enough, are you dropping some of these orders? Have you been kind of, stiffed at all by any of the vendors?
Yes and yes. And I think there's a third question, which I think is also yes. But I mean, look, I think we've had trouble with a number of orders, and we have dropped some of those orders if we don't feel like that they're going to come to fruition. And whether that's around isolation gowns or other material. We've also started to think creatively. If we can't get your typical historic, what we think of as an isolation or surgical gown, is there something else that we could substitute for it? Can we source that instead? And what are the costs of that as well? And I think helping our healthcare systems to think through the same thing has been key. But look, we're not shy about begging at this point, we're not borrowing or stealing at this yet, but it has been challenging to say the least.
Have you? At what point do you make the payment to the vendor? Is it upon receivement of the shipment?
In most cases, it's upon receipt. There have been, especially around N95 masks. There's been lots of cases where, you have vendors who say, I want half up front just to start the order, and then they want half before they even will make the delivery. We haven't engaged in that. We have one arrangement with surgical masks that we got comfortable with that had that kind of payment arrangement. Those surgical masks, I believe, have been delivered at this point. But we know that they're on their way, regardless if they've been delivered. But we've also not entered into those arrangements for a host of other things, because either we couldn't confirm that the manufacturer was valid, or that the distributor had a good reputation, or we were just, there are too many questions at the outset. So I think there's all of those things are taken into consideration before we move forward. And there's also checks and balances, right? So it's not just our OEM staff that makes that call. It's also working with finance, the controller, and others before we would ever enter into that sort of arrangement. Okay,
thanks, Brian. What is the improved poncho you mentioned earlier?
I don't think we've actually ordered them yet. We got 5 or 6 different samples of different kind of surgical gown-like things that we have run by the hospital systems, but I don't believe we've placed orders yet.
Okay, thanks so much.
Very good. Thank you, Max. This is the last call for questions. Seeing none, that concludes today's daily briefing. We will be back again tomorrow at 1 p.m. Thank you.